All right, good afternoon, everybody. It is 2:30 now, so I think we'll go ahead and get started in the interest of being on time on a Friday afternoon, so that hopefully we can wrap up a little bit early. My name is Danielle Farisi. I am with the Louisiana Public Health Institute, and I want to welcome you all to the Louisiana and Mississippi Delta Center Community of Practice Information webinar. So I just want, could somebody who's on the line please confirm for me that you can see my screen and it's just showing the slides?
I can see your screen and it's just showing the slides. It looks great.
Thank you so much, Peyton. That's like the constant fear is that I'm going to be showing the screen with my notes on it instead. All right, great. So thank you all for joining us, and thank you for your interest in being part of this exciting opportunity. Joining me today to tell you a little bit more about the Delta Center project and the community of practice are Dr. Will Carter with the Community Health Center Association of Mississippi and Leah Smith with the Louisiana Primary Care Association. So before we move on, I just want to go through a couple of housekeeping things. We are recording this meeting for people who may not have been able to attend this afternoon. We'll make that recording available to them in a few days. I'd also like to request that everybody stay on mute during the presentation. If you do have questions, feel free to enter them into the chat. We have some people who are monitoring those, and we will answer all questions at the end. And we've built in plenty of time to do that. All right. So here's the agenda for today's webinar. I'm going to introduce the team and give some background on the Delta Center. Then Will provide an overview of the community of practice, and Leah will review a bit more about the application process itself. After that, we will answer any questions that you have. So like I said, go ahead and enter them into the chat and we'll get to them all at the end. So first, I'd like to let you know which organizations make up the team that is bringing this community of practice to you. We have staff from each of these organizations on the meeting with us today, and those organizations are the Community Health Center Association of Mississippi, the Louisiana Primary Care Association, the Louisiana Public Health Institute, and the the Mississippi Association of Community Mental Health Clinics. So thank you all for being here today, and thank you all for your collaboration on this project. So our project that is taking place in Louisiana and Mississippi is part of a national initiative called the Delta Center for a Thriving Safety Net. The main goal of this national initiative is to bring behavioral health and primary care entities together to make policy and system changes that will move the whole safety net towards being equitable and better able to meet the needs of the people it serves. The partners that are involved in the Delta Center at the national level are listed here on the screen: the National Council for Mental Wellbeing, NAC, the National Association of Community Health Centers, John Snow International, Families USA, and the Kaiser Permanente Community Fund. So this image that I have up here on the screen is of the home page of the website for the National Delta Center, and I'll go ahead and drop that link into the chat if you're interested in checking that out, and it has information about all of the different sub-projects that are going on all around the country. So with that national context in mind, I'll tell you more about our project in Louisiana and Mississippi. The full name of our project is Advancing Racially Equitable Telehealth Care and Payment in Louisiana and Mississippi. So based on that name, you can see that our focus is on telehealth and making it more equitable and financially sustainable. We have three main strategies that we are employing to reach that goal. First is a policy analysis and recommendations around telehealth. And that will be focusing on things like access, quality, and payment. For our second strategy, we are seeking to address the fact that there is not currently a behavioral health association in Louisiana. There is one in Mississippi, but not in Louisiana. So we're going to explore what the need is for one and also explore the feasibility of starting one. And then our final strategy, the reason why we're all here today, is we are going to convene a community of practice that engages behavioral health and primary care providers who are interested in collaborating together and in making their telehealth services more equitable and more sustainable. So now I am going to hand it over to Will Carter, who will tell you more about the community of practice. And Will, I can go ahead and advance the slide. So if you just want to unmute yourself and talk.
Okay. Good afternoon, everyone. Thank you all for being here. We're very excited to potentially work with as many of you as we possibly can. Danielle, if you just confirm that you can hear me. Okay.
Yes.
Great. All right, so a brief overview for the community of practice. Our purpose is to support primary and behavioral health care organizations in growing and sustaining their telehealth services as a tool for improving patient outcomes and collaborating with each other to provide coordinated, holistic care in an equitable way. So some of the learning objectives or outcomes you can expect to take away from this project are participants will increase their understanding of health equity, including how to apply the concept to their work and how health equity is related to health outcomes. Also, you can expect to increase the capacity of your organization to effectively deliver telehealth beyond the COVID-19 public health emergency period. And lastly, we will improve access to telehealth services in an equitable manner that is aligned with the need and circumstances of the population that you serve. So health equity is the guiding principle for this work. Our curriculum will be based on the needs as well as the priorities of the cohort. Some potential topics that we will cover are patient access, financial considerations, and continuity of care. The duration of this project is approximately 11 months from March of 2022 to February of 2023. And during this time, there will be about 4 things that we ask of each participant. 4 learning sessions. We ask that you would attend 4 check-in points, the dissemination and implementation of the information gathered, and the assessments. There will be a pre and post assessment, and there will be a stipend also for each participating organization of $5,000 per organization. All right, I'll hand it back to you, Danielle.
All right, thanks so much, Will. We'll move on to our next slide and our next presenter, who is Leah. So take it away, Leah.
Good afternoon, everyone, and thank you so much, Danielle, for having me today. I'm going to talk to you all about the application information. There's a download application form, and there's a hyperlink listed here in the slide. You submit your application on the site. Applications are actually due on Valentine's Day, people, February 14th, and notifications to be sent out in March of 2022. Can you advance the slide, please, Danielle?
Yeah, sorry, I'm trying to get those links to drop into the chat for everybody, so bear with me.
Okay, good deal.
Yeah.
Thank you so much. Eligibility, eligible organizations are federal or state designations as a safety net provider. Designation examples would include certified community behavioral health clinics, community mental health clinics, federally qualified health centers, human services authority, local governing entities, and rural health clinics. Our cohorts consist of 4 teams. There's 8 organizations total. And there is a grid here that that shows how the teams are outlined and how everything would fall into place. Each team must be made up of 1 behavioral health organization and 1 primary care organization. And again, that's 4 teams, 8 organizations total. Selection criteria will include established telehealth services, steps to address health equity. Organizations must have a collaborative relationship, alignment with COP goals and objectives, and commitment to active participation. And if there are any questions or concerns, please submit that information in the chat or question and answer box.
We do have one question, and that is from CR. And the question is, if you have both primary care and behavioral health in your facility, can you apply with this, or do you have to coordinate with an outside provider for BH?
All right, that is a great question. And we know that a lot of primary care centers have integrated behavioral health services into their organizations. And we know that some behavioral health organizations have integrated primary care. But in the spirit of the Delta Center and in the spirit of this project, we are asking that organizations do identify an external partner that they would like to work with. So we are asking that it is 2 separate organizations. So if you are one of those organizations that is, primarily a primary care organization and offers some behavioral health, you might want to think about organizations that you work with to provide perhaps more intensive services for your patients who need it. And that might be a good choice of a partner on this project. Great question.
That is all that we have so far, Danielle.
All right, so while people are thinking of their questions and typing them into the chat box, I'm going to get those other links into the chat as well. So just give me a second to bring those back up, and you all can think of any other questions that you might have for us.
We do have another question in the chat box, and the question is, are the services for just individuals currently served in your organization, or will it be expanded to the individuals that you partner with?
I mean, I think probably it would be, and I'm not quite sure I understand the question, so Lisa, if I'm not answering this, just let us know. But basically what we're going to be aiming for is more of implementing change at like the organization or the site level to serve any of your patients. So those, obviously would be the people that you're currently serving, but could potentially also be, new people that you're serving. It could be, maybe opening up or opening wider some of those referral relationships with, the organization that you partner with. So I think I would say probably a little bit of both, if I'm understanding your question correctly. And I'll also share some information based on a conversation that our team had earlier this week, and that somebody brought up the question about whether or not or how organizations should be applying for this, this opportunity. And, you know, whether or not they should be doing it. What I mean by that is whether or not they should be doing it at the organizational level, you know, intending to cover all of their sites, or if they should be just focusing on one single site. And with that, I think it's really going to depend on what your circumstances are. In terms of, you know, how, you know, that site or that organization might be partnering. And the example that we were talking about that hopefully will give a little bit more clarity to this, what I'm talking about is, we know that in both states, the behavioral health organizations tend to cover a very large geographic area that might be an area where many FQHCs are operating. So it would be appropriate for like one particular site who has a relationship with one particular FQHC operator to apply as a team instead of like the entire region's behavioral health provider applying with one FQHC that has like a more focused geographic area, if that makes sense. Oh, I see. Thank you for that clarification, Lisa. I think that is probably one of the things that we can work on, you know, through the Learning Collaborative is identifying the places where it makes sense for people to serve, or for both organizations to, you know, kind of serve each other's clients, and where it doesn't. So the expectation is not there, but I think that's definitely an opportunity to explore. All right. We'll pause for a few more seconds in case anybody else had any lingering questions that they wanted to ask. Also, I'll go ahead and drop my email in the chat. So if you do think of questions later, you can go ahead and send them directly to me. That's how you can get in touch with me. And like Leah said, these applications are due on Valentine's Day. We thought that would be a nice easy date for everybody to remember. So there's still several weeks to prepare things. We tried to make the application not too daunting. It's not going to be, you know, an 80-page document that we're asking for people to fill out. So, but if you do have any questions about that or any questions about the program in general, please feel free to get in touch. I think one more thing that I'd like to clarify while we have time is the expectations around dissemination and implementation. So we laid out what the key activities of the community of practice are going to be, and that is those 4 kind of learning sessions where all the participants come together to learn in a collaborative way. And then we're also going to have 4 check-ins, which are just going to be individual check-ins, which is one team at a time. And what our expectation is in between those activities that whoever is going to be the organization sort of representative for the community of practice, and it might be one person or 2 people, that those people are then the champions for the issues of telehealth and health equity at their organizations, and they can help to bring some of this information back to the staff and help to, you know, start to implement some changes at their sites. So that's what we're talking about when we're talking about dissemination and implementation. And we're not envisioning that being a super heavy lift that is going to require a ton of time outside of the time that we are, meeting together. But we also are encouraging you to integrate that into things that are already existing, infrastructures that you already have in your sites for doing stuff like that. And that might be, your regular staff meetings. You might be able to share information there. Or, if you're looking to change a process, maybe working with your existing quality improvement committees, those types of things. All right. It looks like we don't have any more questions coming in on the chat. So I think we can wrap it up. Does anybody else on the team have anything else they want to add? All right.
No.
All right. Well, thank you all so much for your interest. Thank you to Will and Leah and Randy and Angie for helping out with this webinar today. And we look forward to reading your applications in a few weeks.
Yeah, thank you, Leah, and thank you, Danielle.
Thanks to all
Thank
of y'all
you
for
so
attending
much.
today.